My daughter and I started it in 2000. She's the business mind, I was the baking mind.
Have you tried the routine?
I'm not formally trained for baking, it's all home baking, and originally every recipe in here was a family recipe. Most of them were all family or friends recipes and that. So it's, yeah, to me it's just carrying on traditions and that and history. You get to meet wonderful people, celebrate wonderful occasions with them. You get to create beautiful things. Or it started just in the lower back, but then it would pinch and you'd get the pain down the leg, and then it would go across the toe and everything, and, or even at night while you're sleeping it'll hit. And, you know, you just can't get to sleep because you have to change positions every half hour and that because of the pain and that. So it's, yeah, it's just developed and gotten, the severity of it has gotten worse over the years. It comes and goes, which is what's the hardest thing. You never know when it's going to hit. It just hurts so much that literally we'll be walking in the park and I just have to lay down and not move until I can sort of get control of it. So I just want to be able to do things and continue doing them. I love to travel. I don't want to not be able to do hikes and that because of this, which, you know, you never know if you dare you go out on a hike for fear you may not be able to get back.
The major constraint that we had in Manitoba was that we were only able to perform these surgeries at HSC. Now with this program that we expanded here at Concordia, we have the same instrumentation and the same tools to perform the same surgeries here at Concordia. It expands the capacity that we have as a province to do surgeries. How I describe to patients is when you have arthritis in your knees or in your hips, you get a knee replacement or hip replacement, but there's no such thing as a spine replacement. So I have to kind of relieve the pressure that's placed on your nerve roots by the arthritis. And by doing that, I either make an incision and I remove the bad bone, but that falls in the category of uninstrumented spine surgery. In certain cases, you're not eligible for that uninstrumented spine surgery. You need to have a more extensive removal of the bone. The disc becomes calcified. And in that case, you have to put screws in and rods that connect the screws to stabilize the spine. It allows me to resect a little bit more bone to free up the nerve roots some more. And that's called an instrumented spine surgery. With the new instrumentation is that unlike the typical spine surgeries that were very long incisions, they were very invasive surgeries, with the new equipment that we have and the techniques that we're using now is we can do them very minimally invasive. So in the past, those surgeries required to stay in the hospital several days. It could be even over a week. And now we're getting them out the same day because we have all this new instrumentation and these modern approaches. From a patient's perspective, they're having a much better outcome because there's less bleeding, less chance of infection, less chance of surgical complications, and they're in a lot less pain after, and they stay in the hospital for a lot less amount of time. Because we're able to get these patients in the hospital, out of the hospital faster, we're able to help more patients faster. Because it's not just the operating room time that's a constraint. To a degree, it's the number of beds that patients are using. Ultimately, this type of procedure, better for patients, it's better for physicians because we have an answer for patients in terms of, I don't know, when is my surgery going to happen? And the last thing is better for the system because we're able to clear patients out of the hospital and help more people in the long run. From a surgeon's perspective, it's very difficult to recruit top talent without this type of instrumentation. Since I became the fellowship program director, we have expanded the number of fellowship spots, so the number of applicants that want to do training with us has increased. I feel proud that we are at a place that we really are top in Canada in terms of our spine program. And when it comes to recruiting talent, we're light years ahead of where we were before we had all this technology. We're not only just doing these instrumented cases, we're able to decrease the workload on HSC, which is freeing up other services, not necessarily spine surgery. We're freeing up the emergency department there. So it's had a trickle-down effect that's been very palpable.
I think that is the side view, and then that's...
I'd like to express gratitude for the management team at Concordia. The chief of surgery in the province is Dr. Bouchel. To do a surgery, there's a lot of people that unfortunately don't get recognized as much, whether it's a device reprocessing person, whether it's the diagnostic imaging people that run the equipment that we're using, whether it's the nursing staff in the OR. I just want to thank everybody that we're being able to get all of this done and done at such a rapid pace.
But now I can do all of this. I have had no pain whatsoever down my leg since the surgery. Recovery time, I mean, I can't believe how quickly I recovered and, like was back up and walking around, and it was just, really good. Dr. Toor suggested walking is the best thing for the recovery and that, so I've been trying to do 10,000 steps every day. I can do it all with no pain. My eldest daughter and I are going on a holiday to Cambodia, Vietnam, and then we're flying to England to visit another daughter. I'm very excited about that because always you were worried you wouldn't be able to enjoy what you're doing because you knew that this pain was going to happen. You didn't know when, but you knew it was going to happen. And now I don't worry at all because everything I've done, nothing has caused pain.
Hi Carol, how you doing? Nice to see you.
Nice to see you.
Nice to see you again. Yeah. So over here is where I put all the screws. So that was your nerve root was pinched right there. Increases the space for that nerve root to come out.
It's wonderful. I keep telling everybody, I can't believe that something so simple solved the problem. It's amazing.